So let's go ahead and start recording today's demo. So today I'm going to do a demonstration on dental dams. So I wish you guys would watch them because we're going to start doing these labs on Monday or Tuesday. And we have limited time, so I can't stress the importance on how important it is to watch these videos. So with enough being said, I'm going to go ahead and start talking about dental dams for us today. All right, so I have some of the equipment that we've gone over. Some of the equipment. So right here, I'm going to kind of turn my camera and point down. So here are the clamps that we talked about. Okay, and I have them out here. I'll work on my camera over the weekend, but so we have some different clamps, and we had talked about the difference between a winged clamp and a not winged clamp. Winged clamps have these projections on the sides right here, if you could see them or not, right? They have a projection on the clamp, and if we talk about the parts of the clamp, right, we have the bow and we have the jaws. The jaws right here is the part that encircles the clamp. These are the holes that you're going to use the forceps with. And so that's a wing clamp. Remember that the number of the clamp is right here on the bow. Got some light shining off the top of it. On the bow is right here. There's a number right here. And if it's a not winged, if it does not have a wing on it like this, no wings, it's going to have a W in front of the number. So right here, this is a 14, and this is a W14. So right here, it says a W14 on the bow. And then over here, because it does not have wings, it's a 14. So basically the jaws are the same. The difference is that one has wings and one doesn't. The one without is a W. I have right here is a 9, which is a butterfly or cervical clamp. This is used on anterior teeth. This is used on anterior teeth, okay? Or it can be used at the cervical margin when we do a class 5 filling, right? And basically the way, and these are premolar clamps, right? Because it goes by the size of the jaws, and you can kind of see that the difference is the size of the jaws, right? Because when we measure the tooth or which clamp we're going to use, it's determined by the mesial to distal width of that tooth right here, righty? So that's what the difference is going to be there, all right? Now I have out over here, I have some of the rest of the supplies on my tray over here. So I have my dental dam, right? I have a 6-inch medium, and they come in different colors, better contrast with the teeth than a tan color, how they were in the old-fashioned days. This is latex free. It also comes in a 5x5. I know a lot of people got that wrong on their test. And 5x5 is smaller. It can be used for the anterior teeth and also for children. I have my dental dam frame. Okay, this is a U-shaped. It's plastic. It's good if we have to take an X-ray and we don't have to remove it because the radiation will go right through it. I have my dental dam forceps right here. Okay, I'll show you how to use that in just a second. I have my dental dam forceps, and this is the stylus is right here, and that's the part that's going to punch the hole for us. And then we have the plate that has the different size holes right here, okay? And the largest hole would be in a 5. And I use this hole most of the time. And then we can use a smaller hole when we get to some anterior teeth and premolars. So I did mention that if you can look, see if you can see this, but right in here, there's a bunch of dental dam material. So we do have to clean that out. You just take a Explorer and pop those extra little, any dental dam material that's stuck in the holes. I have a crown and collar scissor right here. Okay, and then I have my basic setup. I have a spoon excavator. I have some floss for my ligature, and I have this, which is a wedget. Let me show you that. It's kind of cool. And wedgets are used as for ligature, and it's a brand new one. Let me pull this up just a little bit. Okay, so just like floss, you put it under this little cutter, and it's stretchy. Okay, so it thins out when you pull it out, so you can put it between the teeth like floss, and then it gets fat again, so it holds the dental dam in place a little bit better. All righty, so I'm going to get started to show you how we place a dental dam. So there's a couple of different types of dental dams that you can use. You can use a conventional, what I call an interceptal dental dam, which means that it gets placed down between every tooth. We can have a split dam, which can be used if we're working on like a crown prep, right, where we have to have access to 360 degrees around the tooth. So if we have a dental dam that goes between every tooth, when we use the burr in between the teeth, it can get caught up in the dam. So that's why a split dam might be used, because it makes a really weird noise once the burr gets lodged with the dental dam, and then you have to change the whole dental dam, and that's a whole nother big pain in the neck. And then we can also put a dam on to do anterior fillings. Now, when teeth get bleached, a dental dam is used to protect the gingival tissue, but they actually have, with the different in-office bleaching systems, they actually come with a type of dental dam comes with the system, and it's actually a pretty cool type of liquid dental dam because it's kind of just placed on the gingival tissue, and that's actually light cured, so that's pretty cool. All right, so I'm going to start placing my interceptal dental dam, and let me show you how that's done. So the first thing I need to do is I need to determine what type of treatment my dentist is going to do, and let's say, and which tooth is going to be the anchor tooth, right, and which tooth is going to, what we're doing. So let's say I'm going to do treatment on tooth number, getting everything ready here. So let's say our treatment tooth is going to be tooth number, we're going to do treatment on tooth number 19 and tooth number 20. So with that being said, our anchor tooth is going to be tooth number 18 because it's one tooth behind the tooth that we're treating. And we're going to pull the dam at least one tooth in front of the treatment teeth. So I'm going to pull my dental dam. Actually, I'm going to pull it all the way to tooth number 22. So I'm going to take my template, which is right here. This is a little bit different than the stamp that they showed in the chapter. And I always make just a little X mark up here so I know where the nose goes, or what part of the dental dam faces up towards the maxillary. And then I'm going to put my template on top or on the bottom of my dam. And because I like my holes a little bit more up towards the top, because it's going to give me a little bit more room to stretch my dental dam, I'm just going to kind of move it down just a little bit like that, because this way my holes are a little bit closer to the bottom. So I'm going to just move it up just slightly. So I need to make a hole for 18 as my anchor tooth, 19 and 20 are my treatment teeth. And because I said I was going to pull it all the way through to 22, I'm I'm going to make a hole. I'm going to make a mark for all those teeth. So I have a mark. If you can see that, but I have a mark for all the teeth I'm going to punch a hole for. Okay. Now I'm going to take my forceps right here, and I have it, not my forceps, my punch. I have it on the largest hole, and I'm going to punch the largest hole for my anchor tooth, and I'll go one down for my tooth number 19, and I will use that for all the rest of my teeth, actually. So now I have a hole for all my teeth. Okay. Now I'm going to pull a molar clamp out of my assortment that I have, and normally they may use a clamp kind of like this W7, which is flat on a tooth that is not broken down at all. But I'm going to use a 14 because the teeth that we have on our typodont are aren't like most teeth, right? They're made out of plastic and they're super glossy, and they're not shaped like normal teeth. So I'm going to show you, similar to the video that I posted, the one-step method. So first I need to take a ligature and put it on my bow. I'm just going to fold my floss in half. I'm going to put my loop under my bow. So I'm making a slip knot. I'm going to take the other two ends and put it through my loop, and so I have a knot. Okay, so right we go. We have a little slip knot going on, right? So I know he put it under here. I do it a little different. I'm going to put it on the top of my dam, and I'm going to put it just under my wings, like so. Okay, so you can see that, right? I put my wings through my hole. Okay, so all you can see is, so now I have my bow sticking out, my wings are underneath or through my hole. Okay, so I'm going to open up this mouth a little bit just so you can see what I'm doing. No, I'm not. And it makes it hard for me to put the rest of the dam on. I'm going to keep my frame close at hand. So now I'm going to take my forceps and put it through the holes on my clamp, like so. Okay. The part of the dam that has the X on it is going to go up towards the maxillary. And I'm going to hold on to my dental dam, and I'm going to look for tooth number 18. Kind of pull all this towards me. And I'm going to slip this over tooth number 18. Turn this around towards you a little bit more. Let me see if I can angle this. And I'm going to slip it over tooth number 18. So in order to open up the jaws of my clamp so I can put it around my tooth, I'm going to pull these handles together. And in order to keep it on, right, because it's going to come off, I'm going to pull the handles together and pull this bar down. And so now it all stay together as one piece. Okay. So I'm gonna have to open this so you guys can see what I'm doing. Just a second. There we go. So I'm going to take this and I'm going to hold my dam out of my patient's mouth, and I'm going to put it over tooth number 18, like so. And I'm going to make sure that it's sitting on my tooth and not on the mucosa or the gingiva. There we go. Make sure all my holes are there. And give it a little tug, right? So that I make sure that when I start manipulating everything, it's not going to come off. All right, so that's what it should look like. Like so. All righty. So once that's done, I'm going to loosely put on my dental dam frame to keep all this dental dam out of my way, so I can see what I'm doing. All right, so that's what it should look like. Now I'm going to pull the holes of my dental dam up and over my teeth. And the dental dam, right, that is between the holes is called the septum. And I can kind of floss those down interproximally. Until I can grab hold of my floss. There we go. Let me pull her maxilla up over her. I like how she's a she, huh? I'm gonna kind of close this so you can get a better idea with what I'm working with. There we go. Open up, Lucille. I'm not quite that open. And if you got my email, the video from yesterday has finished uploading to YouTube. And so hopefully the link will work that I sent you. I posted. All right, so there we go. And it is kind of dark. There we go. So you can see that the septum is between all these teeth, and now I just need to floss it down. I'm gonna use my spoon excavator to invert my dam underneath the wings so that it goes underneath the holes of the clamp, so that saliva cannot come up through the holes of the clamp. Bring that a little bit closer for you so you can see it a little bit better. Do the same thing on the lingual. You should be able to see that. I know it's blurry, guys. I'm not quite sure why my camera is not doing what I want it to do. Now I'm going to take some floss that I've already have right here, and I'm going to make sure that the septum goes all the way down into the embrasure area. Let me pull it out through the side, and you can see that the septum, or the floss that, or the dam that is between each hole, is going down in between these teeth and down into the embrasure, like so. Can you see how those all went down for me? Now I'm going to adjust my dam so that it looks a little bit better now. And as you can see, I have a little bit of pink or gingiva showing right here. Right here. And I can adjust that so that that's not showing. There we go. Alrighty, so there we have an interproximal or interseptal dam. It goes down between each tooth. We floss it down into each embrasure, or into interproximally or proximally on each tooth. Some dentists might also want it to go down into the sulcus, so we can kind of tuck it down into where the sulcus is. I hope you guys remember where that is. Tuck it, and you can pull it like so, and we would check on the lingual also. So look in our mirror and check to make sure that the whole tooth is exposed. Now, we have a little problem with this though, because it might interfere if I was trying to put a Tafelmeyer on, right? Because I might not be able to place it all the way down interproximally. And that might be where we can use that sectional matrix, might work pretty good with that. So, like I said, this is an interseptal dam or interproximal dam that gets placed between each tooth. Now, sometimes if there's a problem with leakage where it might not be fitting quite so well, what you can do is, what the dentist might do, is take some material and place it in that area where it's where they may have used up some iron, something that's prevent moisture from coming in. And what you can do is say, this is Cabot. It's Cabot that is kind of hard Cabot, but I may take some Cabot, roll it up, and maybe we just need to place it if the dam is leaking. Say the tooth is broken down, we can't get a good clamp to fit on it, and my Cabot isn't working very well right now, but usually if I roll it, I can get it to work. Okay, so say this isn't making a good seal, so maybe I need to take some temporary material. So say it's still leaking back here, I can take some of this temporary material and kind of pack it in here. You see what I'm doing? And that would prevent any extra moisture from coming in right there. I could do it on both sides. And then that would prevent any extra moisture from coming up. Now, if I'm going to take this off, the first thing that I would do is take this cavity off, and it would need to be suctioned out with your HVE. And then I would use my crown and collar scissors. I didn't put a ligature. Nobody reminded me, right? If I was using wedges, my ligature would go up here. And that's just to confirm that my dental dam's not going to come off. And this would be cut here, and this would be cut here. Okay, so that's what a ligature for. So this one's called a ligature 2, and then this one's called a ligature 2. Okay, it's just something that's going to kind of tie it in place, let's say. So if I'm going to remove this, or if the dentist is going to remove it, the first thing you're going to give them is your cotton pliers. You're going to take the ligature out first, hopefully. Then we're going to pull the dental dam away from the septum portion. Then you pass him the rubber dam forceps. And then everything comes off at one time. You pass it, either he pass it to you, or you remove it away from the patient's face to the side, or say to the bottom. We don't want to lift it up over the patient's face because the back of it is going to have saliva and moisture on it. See what happens when you don't cut one? It gets stuck between the teeth. Now, I do want to make sure that there isn't any rubber dam stuck between the teeth, but there does look like there's some. So I'm going to take a little bit of floss and just floss that out. You see how that came out? All right. So now my patient's all done and is all ready to go. Okay. Of course, we would rinse them out, check their bite, and do whatever protocol is normally done when we are doing a regular filling. Okay. So that was like I said, an interseptal dam. Now the next one I wanted to show you is a split dam. Maybe if you're putting a matrix on the tooth, maybe if you are using a matrix, or maybe if you're doing a crown prep and you want to expose all around this tooth. Okay, so we're going to do the same thing that we did before, and this time we can do a maxillary tooth. So I'll throw that one away, and I can take my ligature off the clip I used before. Easiest way to clean up right after yourself. There we go. Okay, so this time I'm going to do the maxillary right. Might be easier for you to see if I turn my Tyvadon around, and maybe you can see this side a little bit better. So I'm going to do a split dam, and my treatment this time is going to be on tooth number 4. So my anchor tooth can be either tooth number 3 or number 2, but I'm going to make it, let's see, I'll make it tooth number 3. And let's say I'm doing a crown on tooth, I'll say I'm doing a crown on tooth numbers 4 and 5, and I'm going to pull my dam all the way up between to number 6. So I'm going to go ahead and again, I have a dental dam right here. I am going to place an X where the nose goes. I'm going to take the template that I have and I'm going to drop everything on the floor. Just remember, if you drop something on the floor in the office, you don't pick it up off the floor, you go and get a new one, right? All right. So I said number 3 was my anchor tooth. And I'm working on 4 and 5, and I'm going to pull it up all the way to number 6. I'm going to take the picture back, and I'm going to work on the doctor's side because you can do that if the dentist isn't in the chair. Here is my dental dam. I'm going to use, let's see which clamp I'm going to use. I think I'm going to try this 8 because look at the size of this tooth. Well, it is pretty big from the mesial to the distal. So I think I can use the 14 again. I have our little handy box here, and please, when you put them back, do not mix them up. No, I think I did when I just separated them all. Again, and if you don't know what size clamp to use, you know, you can always just put it back on, try it on the tooth before you actually set up your whole dental dam. Right, I can put it on, grab it, make sure it's tight, look at it before you get it on, and then you realize that the clamp is too big or too small. That fits pretty good. Let's try this 8A and see if it fits any better. I don't think it is because it's a little bit smaller, but let's see. I can try it on. Nope, it's a little too loose. So I'm going to go with my 14. There is a 14A and it has bigger jaws, which is right here. So there's tons of different numbers for these clamps. But your dentist usually has the favorite ones that he likes that he's going to use all the time. And then he has some others that have maybe the jaws are like serrated. The 14A. No, I think the best one was the 14. So I'm going to go ahead and use that one. All right, my decision has been made. I'm going to use the 14, which is right here. All righty. So now I'm going to go ahead and punch my dental dam. That's not the hole I usually use for the anchor tooth, but I'm going to see if I can make it a little bigger. No, okay. Well, I'll do with what I have. It's one thing you have to be as a dental assistant is adaptable. There's my holes. Okay, so again, I'm going to take my clamp, but this time I am not going to put it with over my wings. I'm going to do it the way Dr. Romero did in the video, and I'm just going to have my bow exposed. So for my anchor tooth, and I still could do it the other way. but since it's the maxillary, it's a little bit harder to see my tooth. So here I have my clamp with just the bow sticking out, okay, like so. And I'm going to take my forceps. I'm going to put it through the holes of my clamp. And I'm going to put it around tooth number 3, like so. Get some floss ready so that I can not have to be doing this. I'm going to take my dental dam frame, and it's kind of easier if you hold it like so with one hand, and when you pull it up, not too tight right now because we still have to adjust it, right? So I'm gonna, my patient keeps moving. She's not being very cooperative. I'm gonna put it just loose enough to get it out of my way, out of my patient's mouth to make her comfortable so I can see what I'm doing in here, right? You kind of have to take it and like pull it so that the prongs on my frame actually hold on to my frame here, okay? So now I'm gonna pull it down, each of the pieces of dental dam. Pull over the teeth that I'm trying to expose. But this time I'm going to do a split dam. So what that means is I'm going to take my scissor, I'm going to cut my dam. Aha, you say, because I want to be able to work on these teeth so I can work completely around them and do a crown prep, which I need to have complete 360, right? I can't have any dental dam in my way. So this time I cut it, and I don't have to use floss to go down between each hole. But what I do need to do is secure it at the very front. So I am going to take my widget, and I am going to secure the very front of my, sorry, I have to work this way. And I am going to put my ligature here. Cut it. And I'm going to cut it on the lingual. I'm going to check to make sure that the dental dam is inverted under the holes of the clamp, which I don't know if you guys can see that or not, but that's very important because we don't want any saliva coming up. But what's going to happen, right, because it's not completely isolated, right, we're going to have a lot of moisture coming up. So what has to happen is that I'm going to take a cotton roll and I'm going to put it right here. Between the patient's cheek and the patient's maxilla, right? And that's going to help with any moisture that's going to come up that way. And that might have to be changed periodically, but that'll work. Now, if we use it on the mandible, I can actually put a cotton roll on the buccal and lingual side, but on the maxillary, there's nothing to hold a cotton roll on the lingual side of the arch because there's no tongue or anything. Then I'm going to adjust my dam so it looks really pretty, right? So it's not bunched up anywhere. You don't want to pull it too tight because we want to still make sure everything's isolated. And so now we have a dam that dentist can do whatever he needs 360 degrees and make sure that the burr is not going to get stuck anywhere. Oh man, I forgot to put the ligature on. Well, I can sneak a little ligature on here if I need to, right? I can take this and kind of sneak it on here because, you know, what if the dentist comes in and goes, well, Miss Franks, you didn't put the ligature on. Well, I can just kind of sneak it on there. There we go. All right, it's done. We got the ligature on. Saliva ejector goes in on the opposite side between their tongue and the lingual of the teeth. Now, what if my patient tells me, I can't do this, I'm claustrophobic, I can't breathe with this on? Well, they can. There's a huge hole right here on this side, okay? But say they can't, one thing we can do is kind of grab a little bit of this and make a hole in it. There you go, patient. You got, now you have another hole right here. Okay. So that is a split dam. It's called a split dam. When we take this off, we're gonna take out the septum that's in the front. And I actually dropped my cotton pliers on the floor. So let me get another one real quick. Little wedges are nice, but yeah, I did it right. Okay. But they're a little hard to take out, I must admit. All right, well, I'm just gonna there we go. Then I'm gonna take my forceps and I'm gonna look in here and take the clamp off. And all in one swoop, we're going to take this off to the side. Take a look, make sure that we haven't left anything behind. This is all impression material somebody left on this Tyvek. Then we can rinse them out, use articulating paper, adjust the bite, post-op instructions, and we're done. All right, so that was number 2. And we have a short 15 minutes to do an anterior. Sorry about that. Sure you don't want to look at that part of me or that part of me. Now we're going to do a quick anterior dam. Okay, this one should be a lot easier for you guys to see. Usually on anteriors, they may do it just for visibility more than anything. So, and it's usually say from K9 to K9. So that's what we're going to do. Again, I got my rubber dam template here. I'm going to put a little marking where the nose goes on the top of the dam. I'm going to punch it. For whichever teeth I'm going to need exposed. I'm going to do first premolar to first premolar. I am going to use a smaller hole. I'll use a number 2. I'm going to punch my dam. And I like to, when I punch it and push it. Because sometimes these little tags of dental dam that you see here stick to this dental dam. And when you try to pull it off, it tears the dam. And then you have to get another dam. So that's just a little heads up. Because you don't want those little tags of dental dam to be stuck on your dam. You don't want them there. I know those little things seem silly, but they do make a difference. So you can do this one or two ways. You can do it with having it on here and doing it all in one motion. So you can put it on here like so. And then you would stand behind the patient or sit behind the patient and line up your teeth with the holes, right? You're going to put the two center holes for 8 and 9 over the teeth that you're working on. And kind of shimmy the septums down in between the teeth. Because hopefully you can kind of floss them down in between. And after you get a couple started, then you can come back with your floss. But the patient keeps moving on me again. But I don't really like that because it keeps hitting my patient. So I'm going to take this off, line them up. Well, come on now. I tell you, it's my patient. For some reason, it's not going down between the two centrals. There we go. Much better. Hopefully you won't get left with an extra hole anywhere, which I'm kind of afraid of today. There we go. Because I don't usually have this much trouble. I'm going to start on this end. Kind of changed up my strategy here because for some reason it's not quite working. 1, 2, 3, 4. This one goes around this tooth. Because I use smaller holes, I usually don't use smaller holes. We'll blame it on that, why this will go down the way it's supposed to go. Slide in there. It's crazy. Usually I have no problem with this, but today it's an issue. I know what the problem is. It's because I'm sitting and not standing. I usually stand whenever I do these demonstrations. Here we go. it. I just had a stand. If you notice, I'm doubling my floss when I do it because it just gives you a little bit more strength to your floss. It just kind of helps you push it down more because the septum material is thicker than the diameter of a single piece of floss. So for now, I just want to, I don't know if you guys can see what I'm doing, but I just want to get these initial septums down. Get these over here. Lordy, lordy. Next time, make sure your Tibidont is functioning well. Lesson learned, Mrs. Franks. Before you start putting a dental dam on her, especially an anterior one. So if you can see, I'm using my floss to help stabilize this and to push it down. The whole facial aspect and the whole lingual aspect will eventually be exposed once I'm done flossing my septums into place, placing my ligature on it. So can you guys basically see what I'm doing? Now I can put my frame on to help me see what I'm doing, and there we go. A little bit better. There we go. Don't know what's wrong with my Tibidont, but there we go. I can. But you do need to have your septums down and the whole, like I said, facial aspect of it exposed. There we go. That's much better. And then we could take a piece of floss, run it through the distal here, and I can cut it and leave it there as my ligature. We cut it short, or else it's going to get stuck in the dentist handpiece. I'm going to put another one on the other side over here. Cut it short. Do not leave it long like this, because like I said, it's going to get stuck up in your suction, and it makes a really high-pitched squeaky noise that dentists hate. There we go. Okay, so can you see how much better that looks? And then a cotton roll can go under here. All right, and then let's see what it looks like on the lingual. So some of that needs to be pulled back, but that looks much better. So you'll practice this at school, on campus, and then it will be a clinical test to make sure that you can actually put these on. What actually happens is that I'll give you a couple teeth numbers, and I'll tell you what kind of dam I want you to put on, and you'll have to do it. Alrighty, so there's your anterior dam. So it's a struggle, but you learn how to do it. Anterior dam are my least favorite, as you can tell. If you have any questions, please contact me. I'm pretty sure I'll probably have to upload this to YouTube also, but I'll let you know what happens, and I will post it. It's also posted in the live lecture, the one from yesterday. So I hope you enjoyed today's lecture. I will see you in lab. Have a good day. Bye-bye.